There's no operation that we do that carries no risk, and the risks associated with ACL reconstruction are infection. The risk of an infection following ACL reconstruction is somewhere in the order of 1%, perhaps 0.5%. There's a risk of bleeding after the surgery. It's very rare, but sometimes the knee can blow up with blood after the surgery, which can be painful. Again, it's uncommon. There's a risk of deep vein thrombosis in the calf, or perhaps pulmonary embolus, blood clots in the lungs. Extremely rare in this type of surgery. There's a risk from the anaesthetic, but the vast majority of patients will just sail through the anaesthetic without any issues whatsoever. The big risks associated with this operation are, number one, stiffness, and a very small percentage of people do develop some stiffness following the surgery, either an inability to straighten the knee or loss of flexion or an inability to bend the knee. And in that situation, physio 9 times out of 10 will sort it out, but where necessary we occasionally need to manipulate the knee with the patient asleep to give that movement back, and very, very occasionally carry out surgical procedures to unstiffen a stiff knee. But as I say, it's a rare complication. The other complication that I warn my patients about is failure.
99% of patients get back to all normal activities. 95% of patients can get back to their previous level of sporting activities, but they may not get back to their full level. And in 5% of patients, the graft does not fully take and they do not have as stable a knee as the patient or we would like, and may need it redoing. That is unusual.
So you go through all this, you run onto the pitch, you twist and turn, and the knee gives way. And it can happen. And it's somewhere in the order of approximately 1 to 2%, but much, much higher in the young active population that continue to be sporty. They ruptured it for good reason in the first place. If they do the same thing again, they'll have a similar problem.
An ACL reconstruction will not make your knee stronger than it was before the injury that ruptured your ACL in the first place. So if you go back to football, have another injury that would rupture a normal ACL, you will rupture the graft. We're not going to make it better, and so you may have to come back if that happens.
If you'd like more detailed information about the potential risks associated with ACL surgery, take a look at the ACL booklet, which you can find in the resources section of the website.